So maybe you can tell us a little bit more about gum grafting and when would that be deemed a necessary procedure?
So gum grafting is usually recommended when an individual has recession, so exposure of the root surface, or often when they are planning on having braces or orthodontic therapy and the gums are thin. So certain teeth are flagged that recession is likely to occur in those areas. And gum grafting is a small surgical procedure where we borrow some tissue from the roof of the mouth and transplant it to an area of concern so that we make the gums thicker so that they no longer recede or shrink away, and that we cover a portion or the majority of the recession that's already occurred. And the technology has come a long way. A lot of individuals are concerned because they hear that it's quite uncomfortable after. But we do minimally invasive procedures now. We also fabricate a palatal stent, as we call it, which is, think of it as like Invisalign retainer that covers the roof of the mouth. So in essence, it's a Band-Aid that you would wear after your procedure to cover the roof of the mouth for the first 7 to 10 days. And by wearing that, the level of discomfort that you would have is very minimal. Usually patients report their pain to be about a 1 on a scale of 1 to 10. So it's very minimal discomfort now.
Pain is probably the least there. It's actually the roof of the mouth that's more uncomfortable, isn't it?
Correct, exactly. So on the roof of the mouth, we usually make one tiny little cut and open it like a pocket, for example, harvest a little bit of deeper inside gum tissue and put a dissolving stitch there. So we no longer leave a raw wound in that area. And that area recovers completely. So most patients, after 2 weeks, the area is totally fine. The sensation can take, about maybe 3 months to return back to normal, sometimes a little bit longer, but that usually never bothers anyone. But histologically, under a microscope, that area is back to normal by month 3. Wow. So in an individual who needs more, multiple areas to be grafted, we can go back to the same area every 3 months, take more and more tissue to finish the graft.
Well, isn't it true that tissue in the mouth is probably one of the fastest healing tissues in the body?
Absolutely, absolutely. And the roof of the mouth, it regenerates completely. We usually don't have any concerns at all. Once we take that tissue from the roof of the mouth, we create a little pocket around the tooth that we're grafting or the teeth that we're grafting and slide the tissue beneath the gums. And using a little layer of medical glue, secure it into position. So the area where we grafted the tissue to usually has no discomfort at all. So in essence, the graft makes the gums thicker, so they stop shrinking away. And we cover a large portion of the recession that's there. And sometimes we can actually cover all of the recession that's there. And what determines how much we can cover is the bone around the tooth. So the bone in between the tooth. If you have no bone loss, we can cover all the recession that's occurred. If there's a little bit of bone loss, we can cover less and less.